Hello, I am Dr. Harsha Reddy. I am consultant obstetrics and gynecology. I practice in Cloudnine Hospital, Sarjapur branch and the Bangalore branch in Bangalore. Swelling of the legs, ankle and feet is commonly seen during pregnancy. One of the common complaints which women come to us with, and this we call as pedal edema. Some women also actually complain of swelling. They don't use the exact term swelling of the fingers, but they say that the rings in their fingers are becoming tight. The swelling in the legs, ankle and the feet worsens as the day progresses and is usually seen in the latter part of the pregnancy, usually in the second trimester or third trimester and during the hot weather. A swelling which comes very gradually, progresses very gradually, is not usually harmful to you or to your baby, but it's definitely going to make you feel very uncomfortable. First, let us see why does this swelling happen. So there are numerous reasons why this swelling happens. One reason is the pressure of the growing uterus on the veins within your pelvis, which in turn increases the venous pressures in the lower limbs. Second is because of the excess retention of fluid in your body which happens during pregnancy. This is to ensure that the blood volume is more, and this is to ensure that the blood supply to the fetus as well as to support the pregnancy. Third is due to hormones like relaxin and cortisol. These hormones causes a lot of fluid retention and they also loosen up the ligaments and tendons in the feet. The swelling which happens due to these causes is not harmful and we call it as physiological edema. Sometimes the swelling can happen due to other reasons such as anaemia, that is your haemoglobin being less. Preeclampsia is a condition where the BP increases in the pregnancy. It can be due to certain cardiac problems, that's a heart problems, or due to some kidney problems. So a swelling which comes all of a sudden, especially in the face as well as in the hands, swelling which worsens very quickly, a painful swelling especially in one leg, and a swelling which is not getting relieved by rest, then you definitely need to approach and consult your doctor immediately. Now, how do you manage the physiological edema or the simple swelling of the legs, hand and the feet without any of these other complications? Avoid standing for long periods of time. Even when you are resting, try to rest with your legs up. Avoid wearing shoes or socks which are very uncomfortable, because when the feet swells up, the strap can start pinching your feet. Go for regular walks. Exercise regularly. There are certain exercises which you can do, foot exercises which can improve the circulation of the blood. This in turn reduces the swelling and even reduces the cramps which happen in your calf muscle and as well as the feet. One foot exercise is stretching your feet up and down and doing this at least for 30 times. The other foot exercises is rotating your foot one way in one direction 8 times and 8 times in the other direction, and you can repeat it at least twice or 3 times in a day. In spite of all this, it's very important that you keep yourself well hydrated, reduce your caffeine intake, and some women will also benefit by soaking their feet in water and by wearing compression stockings.